In our May issue this year, volume 2, issue 5, Blake and I both wrote about hip anatomy related research studies on rowing performance. Mine was a specific look at hamstring flexibility, and Blake's investigated hip angle in the rowing position, and both looked at additional factors relating to rowing performance, technique, and reducing injuries, especially low back pain. So viewers should sort of catch up on those articles as context or information for this discussion. Kellie Wilkie is a rockstar physical therapist in the rowing world, having spent 2008 to 2016 working with the Australian rowing team medical staff, publishing extensively on rowing injury research and running her own clinic in Tasmania. Kellie wrote to us after our May issue to say that she had some different perspectives on hamstrings, rowing, and low back pain, and she agreed here to come and then share that knowledge with us. So Kellie, welcome, and thanks for joining us. Anything that I missed from your intro before we get the discussion going?
No, that was spot on. Thanks, Will, and thanks for having me.
We are especially excited to have you too from the low back pain angle, having just this year recently concluded the World Rowing Low Back Pain Task Force. So then Blake reviewed one of those articles in our November issue. So that will come up again, and we're excited to get right into it. So one of the central points from our articles and the discussion around this has been determining what specifically is the hamstring's role in the rowing stroke, and how is this different on ergs, where most of the research happens, versus on water, where the performance happens. So what are your kind of thoughts on all of that, just to start?
Yeah, sure. I've worked with rowers across many levels for a really long period of time. So even when I've been involved with the elite end of the sport and travelling with and supporting the Australian rowing team in my own clinical practice, I've still been seeing lots of school kids. And in Australia, school kids start rowing at about the same time they start growing. So they get back pain often very, very quickly after that because they lose relative flexibility. And what I would say is by the time athletes get to the elite level, often they have what I would consider to be reasonable hamstring length, which is around an 80-degree straight leg raise. But before that, you can often have kids come into your practice with back pain and present with only, say, 40 degrees of a straight leg raise, or really limited hamstring flexibility. And when we think about, say, the velocity of growth in boys when they're around 14 years of age, that somewhere between 14 and 16 years of age, they'll grow in any 1 year 12 centimetres. And when you think about where that growth will come from and how much the long bones have to grow, they lose relative hamstring flexibility at the rate of knots. Now, they lose flexibility everywhere, but our long muscles are particularly compromised. And there's a lot of talk in the rowing literature about what position we need to get into at the catch, and not as much talk about the hamstring's role in the rowing stroke. And I really do think that's because people focus on the very end of the stroke. And when you actually really look at the hip angle relative to the thigh, you don't need an 80-degree straight leg raise. But if you look a little more closer at the position that rowers get into through mid-drive, where you want your pelvis to be quite vertical, and yes, your feet are a little bit below your hips, we are in about a 70 or 80 degrees, straight leg raise through that position. And if you get to that point in mid-drive where you're trying to apply a lot of force and you haven't got hamstring flexibility, then your pelvis starts to rotate backwards really quite quickly as you take up your hamstring, the resistance, if you like, in the hamstring muscle group. And so when you get that posterior pelvic rotation quite quickly in the second half of the actual stroke, that's coupled with lumbar flexion and we're under load. And I suspect that's probably where we get a lot of I suspect that is a risk factor for low back pain, and particularly in the growing athlete that has often relatively short hamstrings.
So one of the things that comes up in the research is what test we use to assess hamstring flexibility. So you're talking about the straight leg raise active here, where the athlete has to raise the leg on their own, or passive, where the clinician is moving it for them.
Yeah, I do it passively, and there's a couple of different ways I actually have a look at hamstring length in the clinic, because if someone's got low back pain and you're actually moving the hamstring and they've got some referred pain down the back of their leg, you might not be testing hamstring length, you might be testing tone as well. So certainly if it's different from side to side and someone's got some back pain, we can't rely on that as a hamstring length measure. But if someone hasn't got low back pain, what I'm really interested in is actually taking the leg up in a straight leg raised position and having a look at where the very first point of resistance comes on. So I would call that R1. And you might be able to take someone, say, 10, 15 degrees further to R2. But with human bodies, we're really good at using our body to the first point of resistance and no further than that. And that's when we start to get motion taken up in the adjacent segments to it. So I look at R1. The other way I do have a look at it is looking at an active straight leg raise, so that a rower will lie on their back and hold their thigh above their hip, and so the knee is directly above the hip, with a relaxed lower leg, and then see how far they can straighten their leg out as well. So having a look at that actively, you only ever get to R1 there also. But what I found quite fascinating is that you can actually have a look at these two measures and get an idea of hamstring length in rowers, and then go and have a look at them on the water, and they seem to be rowing with really, really poor pelvic motion through that second half of their stroke, or going into too much posterior pelvic tilt in the second half of their stroke. So what I've also started looking at, or what I started looking at quite a while ago, and I look at probably with every rower now, is getting them into a seated position, in a long sit position, and having a look at how far they can actively tilt their pelvis forward. And it can be really different to the measurements that you're taking when a rower is lying on their back. When you think about that, if someone's sitting on their ischial tuberosities or their sitting bones, you take up a lot of tension through your ligaments that cover where the sacrum, or the bony plate at the end of your pelvis, connects on to the actual pelvis itself. And the hamstrings in quite a number of the population actually connect up onto that ligamentous system. So what can happen is, in long sitting, when we've actually got pressure through our sitting bones, which is what happens in the rowing stroke, we can actually have more tension through that whole posterior structure than what we can lying down and seeing how far the leg can come up. So really good example of this is we had an Olympic rower that won a gold medal in Beijing, and no matter, his hamstring length was amazing. It was like 100 degrees straight leg raise, but in the rowing stroke, it looked like his hamstrings were really, really tight. And that's when we started playing around with different ways to measure what he was doing. And found that when he was actually sitting in that position, that's when he actually was really, really limited and couldn't get his pelvis over it all. So we then looked at different strategies to try and decrease tension in that whole system, rather than, say, passive stretching without any tension through your bottom itself.
That sounds a little bit more like the sit and reach test, which is kind of often maligned by coaches and practitioners, because you can cheat it basically with more thoracic flexion, more shoulder flexion. How do you see those two being different, or how do you use this test specifically in context?
Yeah, you can do the sit and reach test without actually taking your pelvis to its end of range motion, and particularly if you've got long arms, you can get a really great sit and reach score without actually being in a very good pelvic position at all. So what I do is I put an inclinometer on the back of the actual sacrum, and then actually see how far they can tilt the pelvis forward, and make sure that their feet are not in dorsiflexion, because otherwise I'm really measuring neural tension as well, and make sure that I just get an idea of how much the pelvis can actually move forward. So really specific direction in a sit and reach test. And I know, sit and reach as a screening test has caused a lot of debate across our Australian physios as to whether we think it should be in there or not. And some people do it and some people don't. And I would prefer to do that long sitting test and have a much better look specifically at what the pelvis can do.
Have you seen research using this version of the test? Is there anything in rowing?
No, there's not at all. And that's the tricky thing, right? That there's no research even looking at what the difference is between that test result and a straight leg raise and an active single leg knee extension test. And so clinically, you're having to sort of triage and use your clinical reasoning as to what might be limiting someone in their posterior chain to achieve the flexibility that they need, or the motion that they need without resistance to get into that mid-drive position.
Fascinating. Blake, Joe, anything you guys want to add so far?
Kelly, so if I'm looking at passive versus active versus the seated test, am I just kind of taking all that information collectively, or is that kind of like eliminating and talking me through like what I need to address from your perspective?
Yeah, I think it's definitely giving you some guidance as to how you might want to try and make change. So say, for instance, you've got a young person and they've got a 40-degree straight leg raise. So without even any tension through their sitting bones, they're not going to be able to get into a reasonable mid-drive position. You might be quite happy to give them, say, a long hold stretch with one leg through a doorway and one leg up the wall in a straight leg position, and to hold it for a lovely, long hold, 2-minute hold. And there's not a lot of research that suggests that supports passive stretching as a way of increasing range of motion either, right? But certainly in clinical practice, I will give young kids 2-minute hold stretches once a day for 2 weeks and see 20, 30-degree changes in their straight leg raise. They're obviously a whole lot more pliable. Their tissues are changing and growing all the time. From my perspective, that works. But say, for instance, I see someone that's got a really great straight leg raise and I'm doing that sitting test, and there's a whole lot more restriction than what I've seen. I might do something completely different with them to try and put those passive structures on stretch at the back of their pelvis. Like I might get them to say, stand up and have their knees bent and put their elbows through, say, the dining room table, so they're bent forward from the hips, and then straighten their knees out. So I'm sort of getting stretched more from above. Or those are the people that I might go, okay, these passive structures around the pelvis, I actually want to try and get some creep in these passive structures. I want to really have a look at how you do your deadlift or your RDL and be able to see whether we can get some really good hip hinge through here. And we know that eccentrically loading the hamstrings around the hip can make a change to range of motion around the hip. And we don't really know whether we're changing myofascial tension or whether we're actually adding myofibrils to the actual length of the muscle fibers themselves. There's a little bit of evidence to support that, but monitoring whether that might make change as well. So it sort of guides what I will give the athlete going forward. And sometimes it's a little bit of try and see that didn't work, go to the next thing as well, most definitely, because the research isn't guiding us, right?
One of the things that we wanted to address with those articles is this kind of like, oh, just stretch your hamstrings philosophy that many rowers and coaches seem to have. It's often done with the, sitting on the ground with one leg out in front of you. Yep. and forward fold, stretching to that. Do you think that this kind of assessment that you're describing and this really rigorous approach to pinning down where exactly the limitation is and how to correct it can be done at the boathouse level, or is this something that needs to be referred to a PT or have a PT come work with the program to put this stuff into practice?
Yeah, I get asked this all the time, and I think ideally you would individualize it, right? Because we see that it works for some people and not others. But I think you can do some really safe hamstring stretching with young growing bodies as well. So, when you're lying on your back is completely straight. You can't get movement from the wrong area if you put your leg up the wall and you do that. And so a lot of coaches say, well, a lot of kids can't come all afford to come and get an individual assessment done just for this. What's the best bang for my buck exercise? And I would say that. And I would say, you come off the water and you're nice and warm. You can get your athletes lying on their back, both legs up the wall with their bottom away from the wall a little bit, or if you have got doorways and corners, to do it one leg at a time to be able to really keep the pelvis down on the ground. And it's a lovely safe thing for them to do where they're not stressing their back in lumbar flexion after rowing as well. So I think, we can be idealists, but we also need to make sure that we make some decisions and help coaches be able to implement things in the real world that are going to happen. And, I'm a huge advocate for the fact that, we can be perfect with prescribing the best exercise, but the best exercise is actually the exercise that gets done, right? So if we can implement that into the environment and make it safe, sometimes we're better off to go, this is my best guess, and let's implement that.
In the overall priorities of, let's say we have a rower who seems short at that body over position and who loses their pelvic coordination or goes into lumbar flexion quickly on the drive. We have sort of a bunch of different modalities that we can work with. One is passive stretching for the hamstrings. There's active or dynamic stretching for the hamstrings. There's teaching the motor coordination side with the hip hinge. There's doing eccentric loading like the Romanian deadlift, where you're taking those structures through that whole range of motion. There's foam rolling, or there's using a lacrosse ball or something else to apply manual tension. Kind of how do you see all of this fitting into the priorities for athletes? Because again, it seems to us, just based on our perception, that people often go just straight to the static stretching, and then when the static stretching doesn't work, they either do more static stretching or they abandon it entirely. So how do you kind of advise that?
I think with young athletes, I'll always go static stretching first, because I think I'm confident that you can make a big change in doing that. But you always need to review that person 2 or 3 weeks down the track, because if there's someone that's going to be diligent and not make change and not get any change for the effort that they're putting in, they're not going to continue with it, and they're probably not going to get better by doing it anyway. But at the elite and sub-elite end of the population, where they've been most of the time doing this up until that point, if we've still got restriction, you've got to look to the other things that you've just talked about, and be able to work with the athlete closely to be able to figure out what's going to help them best. And in my experience, it tends to be eccentric loading in the gym that makes the biggest difference by far, around the hip.
Around the hip, okay.
Yep.
Joe reviewed an article in February about the Nordic hamstring curl that found some great results with rowers with low back pain, and that's obviously a heavy eccentric loading exercise for the hamstrings through knee flexion specifically. You see that fitting in with the hip exercises too.
Yeah, it's fascinating, right? Because I've never prescribed that for a rower. I just think, part of my brain thinks, why would you? Because, the movement all happens around the hip. But when we think about the hamstring in the rowing stroke, we don't only want the hamstring to be flexible. And, we don't really know why that Nordic article showed that someone had less back pain. Was it that we were getting the eccentric loading gave more length to the hamstring? We don't really know that. But the other side of it is, did it just make the hamstring stronger? And we've got to think about how the hamstring also is used in the rowing stroke to develop power and to develop strength. And so, the way kids are taught to row is very much a legs down, body back motion. And the reason why they're taught to row like that is rowing is a really hard technical thing to get right. So you're not only doing this legs down, body back motion, you're also controlling 2 oars or 1 oar, and you've got this thing moving underneath you called a boat, and you have to move in with everyone else and match up. It's actually, there's a real art to it, if that makes sense. And once you've got that mastered, then in your sub-elite group, your coaches will be starting to teach an athlete when they're coming into the catch to be able to not only push their legs down, but actually open their pelvis up through the drive at the same time. So then we've got contributors from your hamstrings and glutes contributing to forcing the stroke via a hip extension moment. And so I think we underestimate hamstrings as a driver of strength, definitely, in that second part of the stroke in a controlled way once you've got hamstring length. So that, realistically, even a third of the way into the stroke, we're starting to actually get hamstrings and glutes engaged to be able to contribute to the force development of the rowing stroke. And so, is it that they had greater control and greater strength around the hip that reduced their incidence of getting low back pain, or was it a length-related thing from doing the Nordic hamstring curl? I'm not sure, but it's really nice that we're starting to ask the questions about it, right?
Yeah, the study was a little bit light on the details, and they did use the sit and reach for their evaluation, so they didn't find a change in flexibility. But we know that there's all these other factors going into it, and so for us, that's been part of the fun of Science of Rowing is to drill down on sort of what we think we know or what we know we don't know from the research, find these gaps, question some of our own practices and conventional coaching wisdom, and also bring people on like you who are sort of operating ahead of where the body of research currently is, that we can kind of get the what's actually going on picture. Joe, anything you want to add here?
I was just going to kind of come back to, you mentioned that Olympic athlete that had really good hamstring flexibility, from a standing posture position, but they looked tight when they were on the ergometer or in the rowing boat. So would that be a case where an athlete that demonstrated some of those qualities, you might have them work a little bit more on the rock over or pelvic control versus like static stretching?
Yeah, what we did with him is his actual pelvic control, he was an Olympic gold medalist, and we're still trying to figure it out. Okay, so it wasn't as if he ended up with really poor performance from what he was doing. So then when you're trying to change someone like that, you have to really convince them. And he's someone I had actually seen since he was 18, 19 years old. So we'd had a pretty great relationship, and he was in his late 20s at that stage. And so we really just went on a journey together with how to change that. And he could really feel the resistance of what would happen with his pelvis wanting to rotate back in the second half of the stroke, and wanted to change that as well, and wanted to go on and get better as a rower. And so we focused a lot around eccentric loading in the gym. for him. And because, you know, you do your eccentric loading, but then you've also got your concentric part of that exercise as well, you're adding to your hip extension strength all the time. And so we'd worked really, really hard on getting trunk strength and trunk endurance for him. And we really just focused on lots and lots of control around the hip and in the gym, and making sure that the movement was meaningful and purposeful from the hip itself. And you know, we increased his straight leg raise over time. Like, he was up around 120, 130 degrees, and you don't need that in the rowing stroke. But for whatever reason, when he sat, he took up this tension through his back of his pelvis that limited that. So we ended up getting him from, in that long sitting test, from a negative 18 degree measure, so 18 degrees before vertical, up into just a vertical position. And when your legs are out straight, you know, I think that's pretty reasonable for rowing, because in the rowing boat, your feet are lower than your hips. So we took it on a gym approach, and he could certainly feel a whole lot of tension through his posterior pelvic structures when he was moving through his pelvis really well. And, you know, that's an N=1 example, but it made a really big difference for him.
Just one follow-up.
Kellie,
sorry.
Go ahead, Joe. You got it.
Yeah, just one follow-up question. And this is curious. I've seen these two terms used in some of the literature written by yourself and Dr. Wilson. Can you just define the difference and what your intention is, or what the consensus statement is around trunk strength versus trunk endurance? And actually provide an example of those, please.
Yeah, sure. So essentially what we know in the rowing stroke is that you can push as hard as you want with your legs, but if you're actually not maintaining that push against the oar or transferring it to the oar with your trunk, you're losing the ability to transfer power, if you like, to the oar itself. And a lot of rowers will tell you that the area that they fatigue in a race first is their trunk. And when we actually watch that biomechanically, we see the trunk start to collapse in the rowing stroke. And when I mean collapse, rowers will do one of two different patterns. They will actually collapse into flexion, or they'll actually keep a more upright lumbar spine and actually start to go into some thoracic extension and get their body behind the oar quite a bit. And so you need this ability to be able to turn on all of the muscles of your trunk, and to be able to transfer those forces, if you like, from the push of the legs through to the oar. But what you do with that in the beginning of the stroke compared to the end of the stroke is very different. And so, you know, one of the things Fiona and I debate a lot is she thinks the posterior muscles of the trunk are a lot more important, and I think the anterior muscles of the trunk are a lot more important. And it's great to have these debates, right? But when you really think about the rowing stroke in itself, the very first part of the stroke, you're actually hanging off your posterior structures. So your rectus spinae is working really, really hard. Your lats are working hard. They're actually connecting via your posterior chain to your opposite glutes. So you're hanging off your posterior structures in the first part of your stroke while your legs are driving down. Then when you get to the mid side of the stroke, you actually watch rowers that do it really, really well and have great pelvic control in the middle part of their stroke. Their trunk really expands. Their abs turn on massively in that middle part of the stroke. And I think when you watch the Sinkovic brothers row their double from years ago, so before this Olympiad, you know, you can just see this massive big lock on of trunk in mid-drive, and it just shows you how much strength is needed to be able to transfer those massive forces from the quads and the glutes through to the oar. And then in the second part of the stroke, basically the pelvis is rotating back 20 to 30 degrees, and all of that load goes onto the front of your trunk. So it is your rectus abdominis and your oblique muscles. And at the same time, you might have the boat moving underneath you that you've actually got to adapt with your trunk as well. So huge amount of strength through a rowing stroke, but then you've got to do that repetitively. And the repetitive nature of it means that if you're in a single rowing into a head breeze, you may actually have to do that somewhere between 250 and 300 times in a rowing stroke. You know, if you're in a fast men's 8, it might not be anywhere near that much. So you need to be strong enough to do it, but you need to be strong enough to do it repetitively. And so everyone goes, you know, what are the best ab exercises? And I think, you know, we can't get abdominal strength by doing crunches. Like, we're just not loaded enough. It's nowhere near the same load as what it is in the boat. We've got to get that from Olympic lifting in the gym. And by actually using it well in the boat. But from an endurance point of view, I will prescribe things like 5 lots of 60 short range, you know, crunches on a fit ball, so that athletes can do it repetitively and have 30 seconds rest between each set. And you can get, you know, some of our most elite rowers that I've worked with that can do 20 really well. but can't do it repetitively. And working with those rowers and bringing their endurance up to what it should be, and getting feedback from them with regards to being able to keep transferring that carry, if you like, of the trunk through the stroke as a race goes on or as training goes on, is really positive, and they commit to doing it because it's a whole lot easier to continue to use their trunk in that way through a rowing stroke as they train it, definitely.
I'll note for our viewers, we've all stolen that short range crunch or the seated rock back exercise from you and Dr. Wilson in your research. And if people want to read more about that handoff from the front end and the posterior chain to the back end and the anterior chain, we reviewed a great study in our sample issue on core training for rowers that focuses on that specifically and how that handoff happens with, I think it was Canadian national team rowers.
Fantastic.
You mentioned young male rowers quite a lot for their stiff tissue qualities and being very flexibly limited. What about young women? Are there any trends that you see similarly or differently?
Yeah. Well, we know that females grow at a younger age generally. So they usually have their biggest growth spurt somewhere between the ages of 10 and 12. And depending on where you row around the world, in Australia, you don't tend to start rowing till you go to high school when you're around 13. So often girls have actually gone through that biggest growth spurt and adapted to a certain degree before they've actually got there. And so I find for girls, I need to work harder on getting their trunk strength and their trunk endurance up. And for boys, doesn't matter how great their trunk strength and endurance is, if you can't get into the position because you're not flexible enough, who cares? You can have your six pack, but if you haven't got your hamstring and your hip flexion range and you can't get into the position to use it, you're not going to be able to use it anyway. So I think girls are generally more flexible. We know that, the research acknowledges that, but they go through their growth spurt earlier. And so certainly if girls are starting to row at that time they're going through their growth spurt, you need to be just as aware of what their hamstring length and what their hip flexion range is as they're going through that 10 to 12 stage, most definitely. The one thing we haven't spoken about yet, which is integral, I think, to hamstring length, is a rock over at the back of the stroke. And so I don't think that if you have short hamstrings and you're trying to do the rock over at the back of the stroke, it predisposes you to low back pain at all. But I think it has a massive effect on performance. And so what we look at the end of the stroke is the pelvis is open right up. You don't have as much reliance on hamstring flexibility. But then you've got to sit at the back of that stroke with your abs on, let the boat run out, and then be able to tilt your pelvis forward without popping your knees and allow that boat to move underneath you to come up the slide so that you don't slow the boat down. And that's a really difficult skill. And so less experienced rowers will tilt their pelvis forward and then drag themselves up the slide with their hamstrings. And that really checks a boat and it slows the boat down. And so parents want to prevent injury. Athletes don't give a crap about that. They just want to go faster, okay? And so to be able to talk about hamstring flexibility from an injury prevention point of view to a coach or a parent, but from a performance point of view to a coach or an athlete, usually is the thing that gets them hooked as well. So I'll spend a fair bit of time talking about rock over and how what we want to do is be able to sit at the back of the stroke, let the boat speed run out, tilt your pelvis forward, let the boat run underneath you, and then come up the slide gently. Give yourself a lovely ability to breathe and suck air in because you're actually, nice and relaxed coming up the slide. You can make that boat go a whole lot faster, being technically able in the recovery part of the stroke, being able to suck more air in and not slow the boat down, than training harder to be able to get good boat speed. So it's a really easy sell to young athletes as well, if you put it in performance terms, most definitely.
Kellie, do you have any drills that you would do on land? Like, so not necessarily on an ergometer or in the boat, but like maybe on a Swiss ball or in a seated position to just practice that where there's not as much external stimulus or noise, if you will, around the athlete so they can actually feel that?
Yeah. So to begin with, sitting an athlete on a fit ball and getting them to know where their pelvis is, and the fact that it's a little bit unstable underneath them is, relatively similar to what might happen on a boat. And teaching an athlete what their pelvic movement is and being able to rock it back by 30 degrees, rock it forward by 30 degrees, and or connected to their trunk coming forward, but it's all coming from the pelvis, and being able to teach that motor control initiation is really great. But then what you can do is you can get them down into more long sitting positions and get them to do the same thing once they've got hamstring range. So the lovely thing about sitting on a fit ball is that you've got your hamstrings off stretch and they can actually learn the movement without resisting against any hamstring tone or inflexibility that they have. And then once they're gaining the relative flexibility, if you like, in their posterior chain, you can sit them down onto the ground, like even on a Bosu. So they're just above their feet, and be able to hold their knees down and be able to practice doing that once they've got the hamstring length to be able to do it. And I'll often use that as an active warm-up, even sitting on something like a couple of towels before you go out on the water, and just getting that mechanism into your brain of this is where we want you to move from.
So just a quick follow-up to that. So how concerned, from a strength and conditioning coach standpoint or rowing coach standpoint, if we have an athlete that say can't touch their toes, right? Like, do we take that in the context of that's actually a true movement limitation for the rowing stroke? Or do we also have to kind of keep into context a lot of the information you shared at the beginning of this, where they're going through a growth spurt and they may have periods where they're, very inflexible? How do we approach that?
Yeah, it's really tricky because it's changing all the time, right? And I think open lines of communication of those that are assessing hamstring length and assessing movement control around the pelvis, and letting the coach know when you're ready to actually go for those movement changes is important. Because if the coach is spending a huge amount of time either on the gym floor or on the water teaching how the pelvis should move, and the athlete doesn't have that available for easy movement, there's not going to be a lot of gain there. But also we need to be really great as therapists in saying, hey, we're there now. You can really coach this now. We've got the movement that we need. Really progress this person in the gym. They can do their deadlift off the floor now. They can use their rock over. They've got their movement off the back of the stroke, and making sure that once they've actually got it, rather than us just giving them neuromuscular control exercises and hoping and wishing that they use it on the water, that we actually inform the coach and allow them to coach it once the movement pattern is available and the flexibility is available for the athlete to access.
Yeah, the toe touch is a very common thing that people go to. And I think it's challenging because as athletes grow at different rates, not all long bones are going to grow at the same rate. So you can have one athlete who grows proportionately very differently, really changes their toe touch results. Is that hamstrings? Is that not?
And it's really tricky because one of the biggest things that happens when athletes grow is you usually get muscular adaptation first and then neural adaptation second. And so doing a toe touch is a pretty big neural tension test as well. And how someone actually touches their toes is, you can use a lot of hip movement to do it, and you can use not much hip movement to do it. And some people will preferentially just move in a different way, and you can correct them and show them how to move from their hip, and they may have more free available movement as well. So it's not always, a perfect, accurate way of testing it.
You talked a little bit about the lack of a connection between hamstring flexibility at that rock over position on the recovery and low back pain. It sounds like you see more incidents of low back pain if the athlete doesn't have that range of motion available for the mid-drive position where there's load on those tissues. Is that accurate?
Yeah, and I think you're going into maybe a similar range once you get into rock over, because you're actually moving your pelvis forward, back into a more vertical pelvic position, but you're not under load. So we know that low backs get sore, particularly from a disc point of view, when we're flexed, but also under load. And so in the recovery part of the stroke, we're not under load. So I really don't think that's a big contributor to back pain. It's the mid-drive. And we connect hamstring flexibility for some reason whenever we talk in rowing circles around rock over. But we've got to remember mid-drive is probably the time that we need to be worried about most from an injury perspective.
I wonder if that's partially because the recovery is slower and we can see that limitation more clearly. Whereas when we're on the drive and everything is kind of coming together at that midpoint, there's so much going on that it takes it would be difficult for a coach's eye to really drill down on, it's the hamstring flexibility at that point.
Yeah, it's really nice when rowers wear zooties with that line up them through the pelvis, so you can really see what it's doing really, really nicely. And I've spent a humongous amount of time out on the water with rowing coaches, and it's amazing how rowing coaches look at making the boat go faster in really different ways. Not many of them actually look at rowers' bodies. Most of them are looking at the way the boat's moving, or the way the oars are moving, or what the hands are doing, rather than what a rower's body is doing. And so a lot of the time I'd be out on the water, I'm looking at the body and they're looking at the boat and the oars, and we're putting all of that information together and having discussions about it, because there's so much information. And what do you deliver to the athlete without overloading them? And what do you go, we're just going to wait for that athlete to get off the water and see if they can do that, rather than trying to make them change that and then have another look at it. So it's this sort of big problem solving thing that goes on all the time when you're looking for gains in performance, but also trying to prevent injuries all the time.
When you had a good line too, I think it was actually on Joe's podcast when you were a guest, about how interdisciplinary all of those different areas have to be. So having the strength conditioning staff, having the physical therapy, the medical staff, and the rowing coach and the athlete all engaged, not necessarily all the time, all the same way, but just at different times, is really valuable to put all those different perspectives.
And so I screen a lot of athletes. I screen a lot of school kid rowers, and I do that just with them and their parent in the room. But sub-elite rowers are rowers that are aspiring to get on sort of junior Australian teams, or aspiring to get into the National Training Centre. I actually do that with the strength and conditioning coach and the rowing coach, plus or minus the parent present. So we're actually all in the same room together. So we actually look at all of the flexibility issues and look at the movement control issues. We actually do it in the gym. So then the strength and conditioning coach will go, I've observed this, and let's have a look at this together as well. And then we'll get some video of about the from a technical point of view with the coach, and do it in that really collaborative way, so that it has multi layers. And it's hard to do that without people with really great appreciation and great understanding for the rowing stroke. But if you can get all of those people in the same room at once, the communication around what the athlete needs is really nice, and it really hones in on what you need to work on, what the biggest things you need to work on really quickly are. And it's just the best form of communication. You can't write that stuff in a report. You all see it together, you all explore it together and unpack it together. And I think it's really valuable for the athlete.
That's great. Well, I've got one more question. Blake or Joe, do you have anything that you want to add or ask at this point? Okay. I would like to wrap up with some concise recommendations. You gave your static stretch already, as far as both legs up on the boathouse, or one through the doorway, one up. What else like that should rowers and coaches be looking at, as far as, sort of low hanging fruit or very achievable things that they can work to improve their performance, reduce their injury risk?
Yeah, I think probably the two things that would follow that are making sure that you do have hip hinge exercises in your strength and conditioning program. That athletes want to do squats a lot, and they don't like doing hip hinge exercises because there's resistance to it and they can't do it perfectly. And hip hinge exercises, I think, are great at working on posterior chain strength, but also probably benefit flexibility as well. And then on top of that, being able to add in neuromuscular controls, so as the athlete acquires the ability to move more through the hips, that you allow them to explore how to do that in their brain and teach them how to do that as well.
So when you say hip hinge exercises, we're talking about Romanian deadlift, kettlebell swing, anything else that you would particularly like to include there?
Yeah, look, I think deadlifts are the best exercise rowers can do by a long way, working on posterior chain strength. And you can do that from quite a young age with trap bars very safely, or with deadlift off the ground. Deadlift, single leg RDLs, double leg RDLs, even just teaching athletes to move with a broomstick down their back and hinging from the hips, so they know where their pelvic movement actually comes from, and initial movement patterning before they start loading is really, really important.
And then same question for the neuromuscular or the coordination side. Like what specifically do you recommend, or do you do with people for that?
Yeah, so I think those exercises we talked about before, of sitting on a pit ball and being able to teach an athlete the range of motion their pelvis is going to go through in their rowing stroke, and how their body is connected to that. They're not hard exercises to do, but they certainly will train patterning, and then being able to get them out of that sitting position down more towards a long sit position where their bottom's just above their hips, and be able to learn that as they gain hamstring flexibility as they go along. But, doing something like really simple, like an arabesque as an active movement exercise or active warm-up exercise before you get on the water is quite nice too, of just learning to tilt forward from the pelvis and be able to maximize, you know, your hamstring flexibility just before you go out on the water, I think can be really valuable also.
Got it. Thanks. Is there anything else you want to add on the topic or to this discussion that we haven't asked about?
Yeah, look, the only thing to just add briefly is we didn't speak much about the erg, and you hit the nail on the head at the very beginning of this conversation, Will, saying that most of the research has been done on the erg, not on the water, for lots of different practical reasons. The tricky thing about the static erg is that, yes, it is sloped down slightly so that the seat will run back towards the wheel, but actually just allowing that to do that and following the handle is a very slow progression up the slide. And so most athletes will actually help progress themselves up the slide by using their hamstring when they won't actually, or we don't want them to do that in the rowing stroke. So I suspect the hamstrings are used coming up the slide a whole lot more on the static erg than what they are in the rowing stroke itself. And so sometimes if we're trying to change patterning, maybe we won't want the athlete on the erg that much practicing that neuromuscular control where we're trying to make a really big change in the boat and allowing them to just tilt that pelvis forward, allow the boat to move under rather than pulling themselves up the slide with their hamstrings.
It's definitely a challenge. Thanks for coming back to that.
When you mentioned hopping on the Swiss ball for some of the pelvic control exercises, would you ever regress an athlete to say like a tall sitting position where they're on both knees if they're having a challenging time of like actually getting movement or feeling it? So just changing the posture but keeping the exercise the same.
Yeah, absolutely. And I think, you know, I'm sure you guys would agree with this, working with lots of developing athletes, but trying to get boys to find their pelvis and find how their pelvis move is really, really hard. They often move with it connected to their back. So sometimes you've got to be really creative and not stick around with, if something's really, really hard to achieve, and it's going to take so much brain energy to do it, to just move on really quickly and find another way to do it. And so experimenting around with lots of different positions to be able to get movement of the pelvis independent of the lumbar spine is really, really important.
Really quickly, so in a situation where you're saying you're working on motor control, you prefer them to be on the water, would it be better to be on a dynamic erg if they don't have the option to be on the water?
Yeah, I think certainly the dynamic erg definitely is the actual stroke on a dynamic erg, whether it be a row perfect or putting rowers on sliders on concept 2 ergs, the movement around the pelvis is definitely more similar to what it is on the water. So that would be a really good option. And it's a whole lot easier to teach what the pelvis does off the back of the stroke on a dynamic erg compared to a static erg, most definitely.
Plus, we're reducing load on the spine and on the ribs, and now we've come full circle to when we had you on Science of Rowing First to this time last year, talking about your rib study and the potential benefit to dynamics there.
Absolutely.
Just as we sign off, thank you so much for your time, expertise, and sharing with the rowing community. Where should people look for more from you? And do you have anything coming up in the next few months or early 2022 that we should look for?
Yeah, we've been really busy getting all of this research out via the British Journal of Sports Medicine. So looking up the low back pain consensus statement that's been published and all the articles associated with that through the British Journal of Sports Medicine would be a great place to start. Dr. Larissa Treese and myself in Australia have worked really closely together over quite a few years now, looking at putting resources together for young athletes, and we've called that Growing Bodies, and certainly we have an Instagram account around that and a website around that. But we've really put that on hold over COVID times, partly because we were entrenched in this research that we were doing, but also because it was a lot of face-to-face education, and we just thought there was a bigger issue going on in the world. So we're looking at resurrecting that at the moment. And certainly as Australia is just starting to open up gradually, we might be able to get back to doing some more face-to-face education with coaches and athletes and physios and doctors around Australia in particular.
Great. Well, thank you again so much for joining us here.
No worries. Thanks for having me.